Morning.
Morning. How you doing, Denise?
I'm good. How are you?
Doing very well. It's a beautiful day outside. Well, it's a Washington beautiful day outside. Yeah, it's not like it used to be, huh?
Yeah, last weekend was so gorgeous. Oh my
Yeah,
God.
wasn't it?
Oh,
Yes, it was.
I, I just was so excited.
Fake
Nice.
summer, fake summer.
And now it's back to fall.
Yeah, now it's or June
It just makes
gloom.
it
Yeah.
easier to do spring cleaning when the weather's this bad sometimes.
You know what's really interesting is that when I first moved here, I was really depressed about the rain, the rain, like not again, not again, not again. And so the landlord came by. It was so funny. The landlord came by about a couple of days after we moved in to confirm everything was okay, and it was raining that day. And so I opened the door and I said, "Is it still raining?" And he just started cracking up laughing. Like, I think you better get used to this. Yes, it's still raining.
Well, and this in May is not normal. Like usually like May and June are kind of gloomy. Like the other day, like I was like, it usually doesn't stay like this long, is it? And my partner was like, well, that's because it's usually cloudy at this time. We don't notice like how late it's staying. So appreciate the nice glimmer because true summer will start July 5th.
Okay.
Yes,
Yes,
and then
July 5th. Yes. Yes.
and then it's rainbows and unicorns until smoke season. So but you're used to that from California anyway.
Yes, but I just basically what Sharon was saying about an excuse to be able to clean out. Like the balance is great. Just give me the balance. And so moving here in the wintertime didn't have the balance.
Yeah.
It was just too much of a stark transition from sunny. It was 90, 100 degrees as I was packing up my stuff to move here.
Yeah.
That took a minute, but now that I've been here a while and adjusted, I'm okay. I'm the back and forth. But thanks for pointing that out. That we had an unusual, amount of days of sun when it's normally not. That I'm appreciating that. But now I'm going back to being depressed again. Because now I know what it's capable of.
Oh, Denise, you're just a new Washingtonian. That's all. You're going through the growing phases.
Yes, I am.
The best part about the worst weather is that this keeps job seekers studying and going to school.
Yes, yes.
For healthcare jobs, we like that.
Yes, that's right. This is true. This is true.
Denise, I'm still getting used to Seattle, and I've been here for 3 years.
From where?
Well, from Vegas.
Oh, yeah. Oh, you probably are you liking that it's not as warm?
Oh, yes.
Okay.
Yes. I'm originally from Kentucky and then via Las Vegas and then here. But yeah, I love Washington. But yeah, the rain during the winter time, yeah, it can be challenging.
Mm-hmm. Mm-hmm. Yeah.
Sad lights work. Sad lights work.
Yeah, we have one. We have one. My husband uses, and it's a big one.
Oh.
It really looks like daylight. In fact, if I turn it on.
So, sorry, Denise, I'm imagining walking into your house and there's like this giant sun, like this giant light.
I'm going to show you. Can you see it?
No, your background. Oh, there it is. Okay, got yeah. Okay.
It is big, and you're supposed to sit like, I guess it should be like on your side or something.
Oh, got it. Okay.
It gives me a headache, so I can't. It doesn't benefit me, but it benefits him. He would have coffee in front of it. You sit in front of it for about 20 minutes.
Okay, got it.
Takes
Just
away.
like a tanning bed.
Yeah. 20 minutes. And he says, okay, I'm good. And then when the sun is actually out, he doesn't turn it on.
Well, good morning, everyone. I'm new to the group and I'll wait for a
Oh.
formal introduction. But since I've lived here since 8th grade, moved here from California, Bermuda, and Hawaii, I will say, please remember that there is Sequim, Washington, which is the Sun Belt. You can always drive out there for a little sunshine. And then, of course, whenever you're able to drive a little bit further south, it's always great. But welcome.
Yeah. Well, glad that you joined us, Vonetta. What organization are you with?
I'm sealing Charlotte's Thunder, but I'm with the University of Washington. But the reason I spoke up is that I'm part of an informal group of women of color who like to welcome women who have come to the city because we know it can be an adjustment. So,
Yeah.
or I should say the Pacific Northwest.
Yeah.
Well, excellent. Well,
But I won't take Charlotte's Thunder. I just really wanted to say welcome. So, welcome to the Pacific Northwest.
Thank you. Can you put that organization and contact information in the chat for me?
Yeah, please.
I will.
Yeah, I was going to ask the same thing.
Yes, it's actually, it's an informal group of girlfriends that I have. So it's not an organization.
Oh, okay.
But the city is Sequim, and I don't know if you've been there yet.
Yeah. Well, I was going to say, and we do have a representative from the other sunny option, the Palm Springs of Washington, Yakima. So I saw Dan popping on. James, can you go ahead and forward the slides so we can get folks engaged in the chat, please? All right. Since there'll be a lot of us here, we won't do verbal introductions. But thanks to Vonetta prompting us to introduce folks, if we could go ahead and do that in the chat with your name, title, and organization, please. All right, we have crossed the 30 barrier for folks joining us today. Good morning, Diane. Glad you could join us today.
Good morning. Good morning, everybody.
Morning.
Morning.
All right. Well, we are 5 after the hour, so we're going to go ahead and get started. Please continue to introduce yourself in the chat, and James, if you could forward the slide one more time.
All right.
And our recent transplant from sunny California, Denise, I will turn it over to you for our welcome.
Great. Welcome, everybody. Good morning to this glorious day. And I I'd like to welcome you to our healthcare industry leadership table one quarterly meeting. Going to give you a little bit. My name is Denise Benuelos. I am the director of diversity, inclusion, and equity, inclusion, and diversity and workforce development for Kaiser Permanente. And I'd like to give you a little bit of background about if you're new to HILT. A little bit of background regarding what we do. And, change the slide for me, please.
Yes.
So our purpose is to be a network of diverse, small and large healthcare providers in Seattle, King County, who come together to share and take action on improving access to a skilled healthcare workforce. And so since its launch in May of 2018, HILT organizations have made improving equity and diversity in the region's healthcare workforce and of guiding principles across HILT's committees. So we're really excited to be able to share more about our progress over the last 3 years. We are celebrating our 3-year anniversary of or birthday of our since its inception, and we'd like to recap kind of where we stand today and where we'd like to go in the future. So for today's goals for this meeting is to celebrate our achievements and present goals of the networking going forward, to bring everyone up to speed on HILT's active committees focused on talent pipeline development and behavioral health workforce, and push forward working areas in nursing and healthcare's anti-racist journey. We also want to leverage and knit together multiple conversations and strategies focused on equity and anti-racism in the healthcare industry and in our region, and also provide an ongoing forum for healthcare organizations to agree on shared priorities and projects in 2021. So happy birthday to HILT. We have 3 team captains, and they are DJ3, or also known as DJ3, David Jackson III, myself, Denise Benuelos, and drawing a blank on my 3rd captain, Lisa.
Oh.
Shauna?
Yep. We've got, also on the call today, we've got Wendy Price from Seattle Children's, and Kim Anderson from Swedish is not going to be able to join us today, but I do see Angie Graves from Aegis Living. And as folks are jumping in for a bit, hopefully Randon will be joining us here shortly as well. So I know it's a busy week. I think we're all kind of feeling the crunch of the Zoom swirl as we are in a busy time leading up to Memorial Day. So thank you for the welcome, Denise. And as Denise mentioned, so really quickly, if you're new here, I'm Ryan Davis. I'm one of your friendly co-conveners, along with Liesl from the Workforce Development Council and my colleague James, also from Seattle Jobs Initiative. And our role is to make sure that things run smoothly as as our network comes together today. And as Denise mentioned, it was our 3rd birthday, and we figured that was a good time to kind of gather our captains together and kind of talk about and reflect a little bit about kind of where we've been. And particularly, I don't think when HILT started, we had an idea that our world would be as completely upended as it was, as it has been during the last year, although again, we are seeing some light at the end of the tunnel. So as we had some of that, and James, if you want to go one slide forward, just to kind of get some of those reflections, I do want to call out a couple of our captains to share some of these thoughts. So Wendy, I think you're on the call. Did you want to kind of share out some of the things, the celebratory things that we reflected on as we were having some of those conversations?
Yeah, hi Ryan, can you hear me?
Yes, we can, thank you.
Okay, awesome. Yeah, thanks everybody. Hi, nice to be on the call with everyone this morning. Yeah, we did have a chance to kind of reflect, and boy, 3 years, a lot's happened in 3 years. It's kind of hard to believe, to think back to all of us on this call that were in the conversations and the development when HILT first stood up. But we definitely recognize that there were some reasons to celebrate. There was a lot of value add to bringing this interdisciplinary group together as we focus on the healthcare industry. And really, we have a chance to leverage learning and leverage opportunities that we really are bringing leaders together to be leaders in our region. So also to show other, kind of demonstrate to other industries how multiple organizations can come together to participate in programs and initiatives that are really of shared meaning and value to each organization. And just that we all have collective needs rather than being in competition with one another, that this space really brings us the opportunity to really talk about our collective needs and to be strategic and supportive of one another for the good of our region and for our organization. So I think that's what I would share.
Yeah. And that's great. And yes, healthcare is definitely in a space than some of our other industry sectors in the area. If we brought some tech folks together, they're definitely not ready to be collaborating, particularly on workforce issues. Angie, anything to add from your perspective?
Hi, everyone. Good morning. This is Angie Graves with Aegis Living, and I have also been with HILT since the beginning, and it is absolutely crazy to think it's been 3 years. And I've represented a couple of different organizations. So I just want to say that it's amazing to me and really an awesome thing to see how this group has kind of developed over the years and grown as far as interest and support and cross-organizational coordination when it comes to broadening the diversity and increasing the equity of the healthcare workforce in our region. So nothing really additional to add, just kind of my I think just awe of everybody on the call as far as just really stepping in and doing the right thing for what we need to do for our workforce here in the region. So thanks, everyone.
Great. Thanks, Angie. And Denise, I'll pass the baton over to you. Anything? I know you're kind of one of the new folks as you came up in California. I'm just curious, kind of your kind of first impressions as you came up with the group.
Yeah, thank you. First of all, I felt very welcome coming into the group behind my predecessor and stepping right in and learning all that we're doing as a collective or, as a collective in sharing information, which was really impressive because that's not something I've seen before in the Southern California region. People feel that the competitiveness, I think, keeps them from collaborating more. And a lot of information was shared by everyone that I think was helpful. To even if we didn't adopt the same practices, it gave us some perspective and some thought around how we might want to relook at things based on what others are doing to approach that challenge of hiring and all through the challenge of COVID. So it was a great platform for all of us to learn from, and I definitely like to see us grow from what we're doing now and take it to another level.
Thanks so much, Denise. And man, you teed up the next slide just perfectly there, as we were, because the other been part of the conversation after a little bit of celebration. Unfortunately, we couldn't have, if we were in person, I was hoping we could have some cake and ice cream and 3 big candles to be able to celebrate. But then looking towards the future, I was gonna tee up DJ3 to talk about, because he is super passionate about this idea of speaking with this collective voice, that all of us together are speaking much more powerfully than each of us individual. Any of the other captains on the call want to channel their inner DJ3 and talk about that a little bit? or I guess DJ3 is unreplaceable when it comes to that component. And then I think the other folks, as we said, the information sharing, and then the development of the future healthcare leaders, which we'll share out to talk about our talent pipeline committee, and the exciting event that was there. So as the captains again are working on some of these priorities for the next 12 to 18 months for HILT. Again, the world that we're in is really different than where it was about a year ago, but still some of those different challenges remain. Wendy, any thoughts that you had from some of the other items on this slide about that new vision going forward and the kind of the leaning towards the action component?
Not necessarily, Ryan. I think that, we, on the earlier slide, we did talk about a bias for action. We've done a lot of discussion, a lot of collaborating, and we've launched some really significant events collectively together over the past couple of years that we believe are really laying the foundation for great momentum. So yeah, that's really the focus going forward, is what can we execute and accomplish together, and put a lot of the dialogue that we've been having into actionable programs that are going to make a difference for young people wanting to access careers in healthcare, and for our current workforce to grow and develop, and to meet our workforce shortage needs. And yeah, I think that just channeling our bias for action is a great theme for going forward.
Yeah. Yeah, I think one of the things that came out too was just the importance of recognizing the job quality, and ensuring that that the healthcare sector is a great place to work for all of our workers that have given so much, particularly over the challenges with COVID facing across all the positions, clinical and non-clinical, that have come together to face this crisis head on. So great. So with that, so more to come as we look towards the future of what HILT looks like, and some of those and some of the different components that'll be coming forward. So with that, I'm gonna turn it over to my colleague Liesl to lead us through some of our committee updates, and we have some exciting things on multiple fronts there. So Liesl, I will go on mute and take it away.
Thanks, Ryan. Good morning. Happy 3rd birthday, HILT Network. Yay, very exciting. I did have a cookie this morning for breakfast to celebrate 3 years. So I'm super stoked that we really have some gas in the engine, and we seem to be chicken up the hill, right? After 3 whole years of being a really amazing, successful network of healthcare industry leaders, labor support partners, etc. So moving into our committee updates, the Talent Pipeline Committee, I'm just going to pass it right over to our amazing champion here, Shauna Ruvkin, to talk a little bit about the April virtual student event that we partnered with some amazing partners who are in the room today. Hi, Stephanie, I see you. And you could you can just take it away, Shauna, and I'm going to go through the list and see who else is in the room from our Pierce County. But Shauna, why don't you give us kind of an update on the virtual student event we had in April?
Sure. Thanks, Liesl. Yeah, we had an incredible week, the last week of April. It was an unbelievable lift by a tremendous amount of people. This was not just our second attempt and run at a collectively planned and executed career event as a HILT, but this was also the first time that we tried to do something like this virtually, and the first time that we tried to think a little bit more expansively about our region. And so this was not only a tremendous undertaking in terms of turning a model that was very successful in person into some kind of virtual format that would be accessible, but also a partnership between King and Pierce counties in particular. And in a minute, we'll see partners from really an even more vast region. So this was really an incredible week. And the other thing that I would really call out is that the entire event, when we reflected back on our first effort at doing a collective sort of networked event to provide an opportunity to create better exposure and access to healthcare careers for youth in King County, we had been pretty explicit reaching back to the goal of equity that we had articulated at the very early days of the HILT. And the outreach was very intentional for that first meeting. And I think this event that happened in a virtual space the last week of April, we really redoubled our efforts to be thinking about what it means to have an event like this with not just an equity lens, but a real goal around advancing the anti-racism goals, objectives, sort of body of work that I think is evolving. So this was tremendous. And the good news is we had actual students come. So that was really great. There were, as you can see from the slide, almost 400 students that registered as participants. And then the design of the event, it was over 5 days, and the design was such that students could come for all 5 days, and that was definitely encouraged, but they could also plug in. And if it was just, there was one afternoon that was particularly interesting to them, they could plug in on that day, and that would be their moment to connect. And so you can see that those 400 students represented 114 different schools across Washington, and a little over 200 students were on the line for a pretty massive keynote and opening on the first day. Even a bit more on the second day when we had a panel of healthcare professionals and students, and then 150 each on days 3 and 4 when we had some breakout rooms and people were able to be in slightly more intimate environments with healthcare professionals and with schools as well. And then on the final day, almost 100 who were participated in the college fair on that final day. So a tremendous, tremendous week. And as Liesl mentioned, there were a lot of people who did some particular heavy lifting. Stephanie was really our fearless leader in bringing us all together in planning. Liesl and James from the HILT did a tremendous amount of work. Liesl Sandkyle from the College Success Foundation in Pierce County, unbelievable effort and work, but also an incredible amount of creativity that she brought to this. And a lot of this wouldn't have been possible without both some leadership and financial leading from the AHEC, the Western Washington AHEC, and Corey Garcia Hansen in particular. So tremendous week. And it was really, I think if we advance the slides, we get a little peek at who, some of the people who were involved. There were a number of partners who stepped up as fiscal sponsors. And you can see that was AHEC was really the lead on that. And that was a combination of both college and industry partners and industry associations and our very own HILT, some of our HILT support partners. So we had a number of different sponsors. And then as from a speaker's perspective, oh my goodness, we had a lot of different presenters and folks that helped organize different presentations. And you can see that a number of HILT members are represented there, lots of different segments of the healthcare industry, as well as educational partners and some professional organizations and associations. And then there were a number of people who didn't actually participate, but were part of planning and were part of contributing to the vision and the execution of the week. So it was a true village. You can see from the decoration of logos here, and really a huge heavy lift. And I think with a tremendous amount of lessons learned as well. And I think even as we move, hopefully back into an environment where we can be in person in certain situations, one of the things that I think will be really interesting for us to take a look at here is the extent to which virtual, while it has some limitations, does also expand our access and can compensate for transportation and geographical limitations. And so I think there's an interesting, now that we're learning how to do this, there could be some interesting best practices that we can take from this, even as we go back into an environment where we can be in person. I think I covered everything, but let me know, Liesl, if I missed anything.
No, I think that's really great. Thank you so much, Shauna, for that recap. Just wanted to mention that there's lots more data that we collected over the week. And we are kind of in the weeds with it right now, trying to figure out what story it tells. So there will be more data about the event, the students that were there, the schools that participated, the speakers, all of the feedback that we got from students and teachers. So just know this is just the tip of the iceberg. Let's move on to, all right, Ryan, last talent pipeline committee update.
Oh, yep. Sorry, was taking myself off mute there, and I see I see our friends from WOBS are on the call as well. So we have some exciting news. So while we were bootstrapping this event together, we went out and rustled up some funding to be able to put some more structure around all the amazing work with the Talent Pipeline Committee, not just for the event, but the other strands of work that all of us here at HILT have gotten behind in order to ensure that we are really reaching the communities most in need and the future generation to do that. So I'll actually impromptu, Emily, I think I saw you on the call. Did you want to jump in and say anything?
Hi, Ryan. Great to see you and nice to see everyone. And congratulations for year 3. I think I attended maybe one of the very first meetings at one of your partner organizations. So this is fabulous. And again, kudos to that event. Those numbers are phenomenal. But, you know, when Ryan approached us about potentially partnering with you all to how to help build out more capacity so that we can serve more students, it was just a phenomenal opportunity for us to go ahead and apply for the Career Connect Washington grant, which we received. And so with that grant, what we will be able to do is get a staff member assigned to help build out capacity for the work that you're doing already. And so that hopefully we can go further and make more impact and serve more students with the partnership work. So we're excited. And again, as Ryan mentioned, having a platform that would allow us to kind of house a lot of these activities, from the mentorship to the video library to a variety of different kind of one-stop shop center that we can house a lot of the excellent work and connections that could be made. So we are excited, and thank you all for partnering with us.
Yeah, great. Yes, Emily, looking forward to working there, and yeah, having some permanent staff behind that. And then I did also want to recognize the Gates alumni that provided us some great consulting services. So Lisa James and I work with them to kind of identify what we think those technology needs would be. And they did like 6 months worth of work for us in like less than 6 weeks. And they did it as a pro bono consulting, which then we were able to use for the grant application, which was ultimately successful. So looking forward to partnering with Emily as we move into the next year and be able to reach more youth of color, those on free and reduced lunch, and the English language learners, which are our target populations for HILT. So Lisa, I'll turn it back over to you to move to behavioral health.
Thanks, Ryan. Congrats, Washington Alliance for Better Schools. Really excited that we'll have dedicated efforts towards building and sustaining the student experience package that our amazing Talent Pipeline Committee, in partnership with our K-12 partners, has been forming and framing even pre-pandemic. So behavioral health, I'm going to, again, launch it straight over to Julia O'Connor of the, excuse me, of the Washington Training and Education Coordinating Board. She has been providing our Behavioral Health Committee with the kind of legislative policy updates regarding behavioral health, as well as how our healthcare leaders in the behavioral health space can be involved in informing and flexing our advocacy muscle around behavioral health. And so she's going to give us kind of a brief update of this past legislative session that just ended, and how that's relevant to our behavioral health. So Julia, take it away. And I think it's back one slide. Great. Thanks, Julia.
Thanks, Liesl. So good morning, everyone. Like Liesl said, I'm Julia O'Connor. I'm the Health and Social Policy Advisor at the state's Workforce Training and Education Coordinating Board. You can also just call us the Workforce Board if you'd like to spare yourself that many syllables. So I'm going to keep this as short as possible because I know there's so much exciting information to share today. But we did see a really productive legislative session, especially with regards to healthcare at large, and behavioral health got a lot of top billing in that, which was really exciting. I will also drop my email in the chat because I'm happy to talk offline with folks who want to get more information on the stuff that's on these slides or this slide. But just a few quick highlights to share with you. We produced a report at the end of 2020 that was the culmination of a multi-year stakeholder process that included about 300 stakeholders, several of whom are folks on this call. And we did end up getting 3 of those recommendations funded initially in the governor's budget and then ultimately in the final budget passed by the legislature. So the first is the development of a teaching clinic enhancement rate, which will seek to help compensate the community behavioral health agencies that have already been performing really important supervision and training roles for students, but also for those early career workers who are pursuing clinical licensure. So our hope is to get that developed this year and test it out, and then eventually have the legislature fund it in permanence. The governor is also very committed, obviously, to the role of behavioral health in first response, especially as we see reshaping emergency services. And so there was a $2 million funding allocation that would allow a mental health provider to be included in first response calls that are responding to mental health crisis. So very excited to see how that moves through the implementation process. And then finally, we had recommended forming a specialty work group, knowing that work groups can be a little bit passe, if you will. But when we were tackling background checks as a large stakeholder work group, we were able to very clearly identify ways in which the current structure of background checks prevent folks from either entering or moving through the career pathways in behavioral health. But what we weren't able to do was be lawyers who actually have either the legal jurisdiction or the legal know-how to say, this is where you need to go in and change the current policies. So we had recommended that the Attorney General's office or perhaps a nonprofit law center lead a work group that could really dig into the specifics of background checks and how they're preventing folks who have really valuable lived experience from entering into the behavioral health field. There's a list of bills here and I won't give you all the details on them, but just know that we had a lot of exciting legislation that will either make small corrections that'll help folks get their license easier, do telehealth and telesupervision, and also fund really important and exciting initiatives like the implementation of the 988 behavioral health crisis response line. And finally, I just wanted to highlight that we at the Workforce Board did get some very exciting funding in the legislature to continue our Workforce Advisory Committee, which is really exciting. We were funded for the past biennium, and with such momentum around the behavioral health workforce advocacy, we were hopeful to be able to continue doing that work. And with the sponsorship of Speaker Jenkins, we were able to continue funding that for another 2 years. So I also will invite you, if you are not already participating in our Behavioral Health Workforce Advisory Committee, please reach out to me, and it's an open membership. It is not set by any means. And in general, we don't ever say no to anybody who wants to participate. So we did receive funding for that for another 2 years. We also had continued funding for our Health Workforce Council, which tackles all of healthcare more broadly, not just behavioral health. And we also received funding to do a research partnership with Washington STEM to look at some of the hard data that we're lacking in terms of who is in the behavioral health workforce and who's missing. So happy to answer any questions and speak offline as well.
Thanks, Julia. I know Julia and I met to kind of go over all of this, and we probably could have talked for a few hours. So really, if you have any questions, please connect directly with Julia. She is kind of, she's the person to go to. So thank you so much for being here and providing those updates. So now I have the pleasure of introducing the next slide, Charlotte Jones, who is the Behavioral Health Committee Chair, to provide us with an update on the Behavioral Health Committee work from spring of this year moving into the summer. Charlotte, take it away.
Thanks, Liesl, and happy birthday to HILT. I'm really excited I would like to consider I'm still new to HILT and still learning a lot about this network. As far as the committee, a lot of you probably heard about the announcement from the Balmer Group, along with the University of Washington, that happened on Friday. If you're not, the key, well, there are 4 main components to that, but the objective of the grant is to develop through the School of Social Work to implement a workforce development initiative. And a little bit later in my presentation, I'm going to introduce you to Vanetta. This is going to focus on the clinical workforce needs, specifically for the community behavioral health agencies that, of course, we serve the Medicaid and other low income clients, right? So the conditional grants will provide students across the state, not just King County, to enter into a specialized master's degree program. And there are different ways that BA programs will feed into that. And again, I'm not going to steal Vanetta's introduction. And it will also subsidize the intensive supervision part that a lot of the community-based agencies will be able to provide to the students that are graduating that will go towards employment within the community-based agencies. And then, of course, there is a consortium of participating in higher education programs. So committed to building these cohorts of graduates that will participate, and it will be along with the community-based agencies, which will be identified as we go further into the planning process with the School of Social Work and with Vanetta. As far as I was talking with Michael, and I don't know if Michael's on the call or not, about 3 weeks ago. So gathering information and some data that would be needed over the course of starting this pilot program sound for me, and as far as for the forefront contributors, because they sit in the 4 corners of Washington, will provide some information to them via survey of what some of the community behavioral health agencies are looking for as far as the skills required, and a lot of what we're experiencing in our employment processes at the moment. So there's still a lot of moving pieces. We haven't necessarily had a lot of movement. We were waiting for the assignment of the project manager. And by saying that, I'm going to introduce Vanetta. I'm assuming that you're still here. I closed my screen so that I could see the presentation.
Yes, I'm here, Charlotte.
Vanetta? Okay. Vanetta Barton is the project manager for the grant that we're going to be building, that is being used towards the Workforce Development Initiative. So Vanetta, I'm going to let you introduce yourself and a little bit about the grant and what we're going to be doing.
Sure. So I'll keep it brief because I know you have a lot on your agenda. So Charlotte, thank you again for the opportunity to join today's quarterly meeting. And so I am an alum of UW School of Social Work. I've worked on a couple collective impact projects for the Dean of the School of Social Work. So I'm glad to be very involved in this work, and it's very exciting, and we're really just very just overwhelmed by the Balmer's generous gift. And so on behalf of the School of Social Work, we're really looking at a variety of different activities and opportunities. And I will just share the aim of this initiative is really to, and I'll read it, is to significantly decrease student debt and increase the number and diversity of exceptionally prepared graduates who work in the community behavioral health agencies on which our state's most vulnerable populations depend. And so to accomplish this work, we've identified 6 strategies, and these 6 strategies were really designed to build the framework, the proposal to the Balmer Group. There's still quite a bit of information that still needs to be created and built out, a lot of program development that's still needed, decisions still to be made, but these are the tenets in which we created the proposal. So to accomplish the work, our 6 strategies are to reduce or eliminate student debt, conduct targeted recruitment with a focus on students of color, create closer relationships between higher education programs and community behavioral health agencies, provide career support for students and graduates, measure the program's impact, and support better behavioral health policy. So the initiative is, as Charlotte mentioned, a conditional grant program. It focuses on students working in a comprehensive community behavioral health agency for 3 years post-graduation. And Charlotte and Liesl asked me to share our timeline and our request. And at this moment, we're really focused on the student selection process. And we're working with the higher education, the 13 universities that have accredited counseling and social work programs. And so what I would ask of you is to think about ways in which the first job experience for today's graduates can lead to a career in community behavioral health rather than a stepping stone. And you all know much better than I the statistics around the workforce development challenges and opportunities within the behavioral health field. And so from our perspective, we have a lot to do across Washington State. Charlotte mentioned Michael Smuckler, and he is not on the call today, but he will really be focused on the Community Behavioral Health Agency connection and side of the work. And we're just really glad and looking forward to being a partner. And it's just an great opportunity to think about this new vision for the workforce. So thank you.
Thank you, Vonetta. And yes, we are looking forward to assisting in any way that we possibly can. The Behavioral Health Committee, as we continue to build that out, will hopefully have at least more than, well, as many of the 18 actual agencies that are eligible to participate in this to be a part of this committee so that we can ensure to provide all the information to you that we can. So I look forward to the partnership and working with you. The committee is also, which I don't think is on the slide, we're still interested in partnering and learning more about the apprenticeship programs that is currently being worked on by the training fund. And correct me if I'm wrong, Lisa, is that still the case? Okay.
That's correct. Yeah.
So hopefully I will have more information on that the next time that we present out. And we're looking forward to doing good things. Behavioral health, as you all know, is no different than any other form of healthcare, is very important right now. And as far as in the state of Washington, there's been a 93% increase in those that have reported anxiety and stress need. And over 80% of those individuals, their needs are not being met because there's not enough clinicians to provide that support. So this grant and the things that we're doing is very vital to the mental well-being of Washington, not just King County, but Washington as a whole. So those are pretty staggering numbers. And the last time that we did a study, which was 2 weeks ago, and to do an evaluation of what is the workforce population that's out there that can do a lot of the entry-level roles of mental health, as well as master degree roles and positions, has decreased by 9%. So if you take the last 3 weeks and there's 9% less people in the workforce in Washington, that's huge. So all of us are having the impact of having over 100 openings in the community-based agencies. And that's just for one. Sound, thankfully, has the least openings of those agencies. And it's not because we're doing anything profound, but we're fortunate enough that, we don't have 100 and some odd openings like some of the others do. But I'm just giving you that insight, not for it to be gloom and doom, because we're still caring for our clients in the marginalized populations. But it's really important, the work that we need to do with the Balmer Group in the School of Social Work, and to make some, hopefully, gains in this in the near future. So thank you, everyone.
Yeah, if I can jump in here. Thank you, Charlotte. This is Diane Sossi with SEIU Healthcare, 1199 Northwest. And our union and our multi-employer training fund has been really an anchor partner with all of the folks who've spoken and have been at the table for, over a year, I think. We're going to be started work on the apprenticeship part of this grant. And we're really excited about it because, I think as everybody typically thinks of apprenticeships, we think about the trades. And apprenticeships have really arrived in a very big way in healthcare. We did MA apprenticeship with Kaiser, others that are being teed up in healthcare, but behavioral health is critical because we've heard, and it's written in this these slides, that one of the big obstacles for folks who want to go into this field is debt, is coming out of school and then going into a job where the wages are not yet what they need to be. And that's another piece that we, I think, as a coalition need to think about working on in terms of, how to raise reimbursement rates and make sure that not only can we create a pipeline to get people into these jobs, but we can create sustainable jobs. Thank you.
Thanks so much, Diane. So I'm going to wrap up our Behavioral Health Committee update here because we're going to move on to kind of reviewing the awesome spring education information exchange that we had. So I just put in the chat a link to more information. People keep referring to this Bulmer Group investment in our behavioral health system for Washington State. It's a tremendous amount of money, and the HILT network, as we grow from King County into Pierce, into Snohomish, as more of a regional network of partners, is going to be very important to help inform how those dollars are spent and where they go. So thank you so much. With the partnership for the UW School of Social Work, the majority of that Bulmer investment did go to the University of Washington in one way or another. So we are really excited to be able to plug in to that multi-million-dollar, multi-year investment. Just want to mention real quick, the brand new Behavioral Health Institute at Harborview also received $5.5 million over 3 years. And I'm not sure if Melody McKee is on, but it's definitely part of that work. And I know that they work with Laura. They're working closely on the kind of apprenticeship creation of that behavioral health tech position. So definitely our committee is intent on keeping our finger on that pulse. And then I wanted to just call out that there's financial commitments beyond UW that the Bulmer Group is investing in to support our behavioral health system, which includes piloting projects to test new ways of providing clinical supervision. And I know, at least when I was listening to Charlotte talk, the three big focus areas that our Behavioral Health Committee have said they want to really lean into are recruitment of a diverse multilingual workforce, retention, as well as clinical supervision. And the Bulmer investment, as well as the specific project that we're working with the UW School of Social Work on, addresses one aspect of those focus areas at some point in time or another. So we're really excited about this partnership. Now let's move on to the update or overview of our spring education information exchange.
Hey, Lisa, sorry, I just wanted to, Laura Hopkins was raising her hand. I just wanted to, because I know she has probably has an update on this before we move on. Laura?
Yeah, thanks for realizing that, Ryan.
Yeah.
Hi,
Thank
Laura.
you. Hi. Hey, I just wanted to follow up on what you just said around the Behavioral Health Institute funding. So they are the partner that we're working with on the Behavioral Health Apprenticeship Program. So that funding is actually, we are subcontracting with them for majority of that $5.5 million to build the apprenticeship programs. And we do have all three occupations that we are going to be building. So we have peer counselor, behavioral health technician, and substance use disorder professional. So we have 3 behavioral health apprenticeship programs that we will be starting. And with that funding, we're able to start hiring staff. And our plan is to begin implementation in summer to fall, somewhere in that timeframe of 2022 of all 3 of those programs.
Laura, can you say those 3 occupations one more time, please? This is Wendy.
Absolutely. Behavioral health technician, which is a 1-year apprenticeship program. Peer counselor, which is also a 1-year apprenticeship program. And then substance use disorder professional, or SUDP, which will be a 2-year apprenticeship program.
Thank you.
Thank you.
Awesome. Thanks, Laura.
Thanks, Laura. All right, let's move on to the overview of the spring education information exchange that we had on April 14th. We had great turnout from our healthcare industry partners with an amazing panel of leaders from HealthPoint, hey, Aegis Living, thank you, Angie, and Jennifer Graves from Kaiser Permanente, as well as Public Health, who all spoke up to speak about the changes and the anticipated shifts in nursing demand and the specific nursing skill sets that are still constantly changing, but have come out of the woodwork in our, I guess it's pretty presumptive for me to say post-COVID world, but in this different world, right? And so we also had amazing education partners that spoke to nursing schools numbers and statistics related to nursing school applications and enrollment, specifically our Black, Indigenous, and students of color, as well as any other changes in maybe not curriculum, but specific skills that nursing education was supplementing because of the pandemic. So we had amazing representation from University of Washington, great. Shoreline Community College, thank you so much. Tacoma Community College had to jump off, but provided us with a really great detailed summary in the chat that we were able to talk about, as well as our program director of nursing and the CNA program at Highline College. So it was a really amazing conversation, both with these kind of facilitated panels, as well as breakout rooms where everyone got to lean in, talk with one another, share what's happening in the nursing skills and education realm. We had some big takeaways from this education information exchange mid-April. One is that healthcare organizations are more than welcome. And if anything, we need to set up some sort of system to have our healthcare organizations come talk to post-secondary students about their nursing field, mapping the nursing pipeline and how the seemingly linear nature of nursing education is actually not how the majority of nurses realize and attain their nursing education. And then the last big takeaway was definitely more towards a bias towards action, right? Let's do something. Let's flex our collective advocacy muscle, because we need more students accepted into nursing school. But what we learned from education is that we've got hundreds of applicants, but not that many openings because qualified faculty isn't there. So how can we increase the nursing faculty at our local community and technical colleges to increase the number of students that can be accepted to programs? We know that there was a piece of legislation that was passed that allowed for larger wages subsidized by the state at community technical colleges, which helped tremendously. But as our education partners are reporting the success of that, we heard we just need more, right? It's successful, we just need more. So that's kind of the overview of our information exchange. I think everyone here probably received an email on that. Definitely looking forward to more information from your convening team, as well as our Washington Center for Nursing. Brenda, I do see you. I know that there's some research on the nursing pipeline coming down. I don't want to overpromise, but we're definitely excited to have some smaller separate meetings specific to some of these big takeaways moving into summer and fall of 2021.
Yeah, this is Brenda, and I can speak to that. So we have received some data from the commission, and we requested some supply data as well, which we have not received yet. So, but we'll spend the next few months actually combing through the data and seeing what it tells us and what it shows us. So we'll definitely be in communication, and I look forward to sharing that out. But it does take some time. It's a lot of data. So we're excited to share it with you when we have it ready. Thanks.
Thanks, Brenda.
I would also add that the next iteration of the Future of Nursing report just came out in the last week. The first one came out, I don't know, I want to say 10 years ago. And this is a very comprehensive, the Institute of Medicine, RWJ, a number of other stakeholders have been involved, and researchers and nurses all over the country. So I think it would be great if we could, Liza, give people a link to that.
And this is Brenda again. I will look up these links right now and put them in the chat box if that's convenient for you guys. Lisa, are you okay with that?
I'd appreciate that, Brenda. Thank
Great.
you. All right, Ryan, mic is yours. Oh, sorry. Is it Wendy?
Yeah, I was going to say, I don't want to jump in front of Wendy.
Nope. Wendy, the mic is yours.
All right, I unmuted my mic. Thanks, Liesl. Well, gosh, as we've heard throughout this entire morning, there continues to be a ton happening across the HILT network, and there are some things coming up this summer. Even though summer tends to be a time when people might take respite and are away, please know that there are a few events and activities taking place over the next few months. So my job here is to let you all know what's coming. So one thing we wanted to share out with this group is that, as many of you may know and remember kind of from the early years, early meetings in HILT, Seattle Children's has been working kind of ongoing over the years on our IT career pathway and really digging into creating a process and actually a system that helps create access and then support people to come in and grow in IT, in their IT career. So the next iteration of that work is actually a partnership that we've been working on specifically with Seattle colleges and Seattle Central around the development of a short-term micro-credential certificate. And looking at we just implemented Epic org-wide over the past year. So Epic is definitely a reality in our organization. And so looking at how this micro-credential might even not only open up the pipeline a little bit more as the credential builds on the associate's degree to the bachelor's degree, but also how that might support us growing our workforce that specifically supports our Epic needs. So that's looking at roles that might support desktop technician, service desk techs, and maybe even Epic analyst associates. So if there's anyone that's continues to be interested in that work and is wanting to know more about some of the credentialing that we're partnering on and some of our children's career pathway thinking in the IT space, we're doing a lunch and learn on June 14th from 12:30 to 1:30. So I wanted to put a plug in for that. There's a support partners meeting that's coming up on the 9th, and I believe that's June 9th. Is that a thumbs up, Liesl? June 9th? Great.
Yeah, my bad. It's Wednesday, June 9th, not Wednesday, June 10th.
Yeah, no worries. So I'm assuming that's also going to be Zoom, virtual meeting for our HILT support partners. So put that on your calendar. We just heard about the awesome nursing info exchange in the spring. There's going to be one coming up in the summer. So that's scheduled for Wednesday, July 21st at 3 p.m. And I think the focus is still being determined for that info exchange. Liesl, is that right too? Leaning on you here a bit.
Yes. Now the focus of that is still TBD. So if anyone has any kind of hot button issues, Ryan, James, myself, you know where to reach us.
Awesome. And then the last thing is just yet to be scheduled, but there will be ongoing committee meetings to move this work forward. So the Talent Pipeline Committee, a group of people that want to continue digging into the nursing space, and then the ongoing amazing stuff happening in behavioral health. So those are the summer updates. Thanks, Liesl.
Thanks so much, Wendy. Appreciate that. Yeah, if anyone needs a calendar invite, please reach out directly to me. And with that, I'll hand the mic to Ryan.
Okay, great. Thanks, Liesl. And I'm going to be channeling my inner Randon as we introduce some very special guests that we have with us to tee up our conversation today. At HILT, we've had several very robust conversations around what it means for our network to be anti-racist and what it means for healthcare in our region to embrace anti-racism, specifically talking about the tools that people need, and then to make sure that we're qualified to continue that work and that we're doing that with the appropriate time, the effort, and then the intention to be able to get things over the, to translate the talk into some action. And so joining us today are two colleagues from Healthier Here. And we are very pleased to have with us Sarah McLaughlin, who is the Executive Director of Healthier Here, and Victor Liu, the Board Chair of Healthier Here. So I'm going to actually just allow them to introduce themselves really quickly. So Sarah, I'm going to pass it to you first. If you just kind of, you would first introduce yourself and then just talk a little bit broadly about what Healthier Here is and does for some of our members that may not be aware.
I'm on mute, sorry. Thanks, Ryan. And just for clarity, it's Susan McLaughlin.
Oh, Susan, oh, sorry about that, okay.
I wish I was Sarah the singer, but I don't have that talent. And I am going to, Victor, I'm going to let you introduce yourself while I pull up, if I can have the screen sharing, Ryan, and pull up our slides, that would be great.
Oh, sure, great.
Sounds great. I almost wanted to say thank you, Sarah, but I know it's Susan. Yes, so good morning, everyone. So my name is Victor Liu. For this context, I use he, him, his pronouns. I'm the Executive Director of Seattle Counseling Service. And I also sit on the Healthier Here governing board representing the behavioral health sector and also on its executive committee along with Susan and fellow board members.
Thanks, Victor. And are you guys seeing the Healthier Here slide?
Yes.
Okay, perfect. And so, again, I'm Susan McLaughlin, and I'm the Executive Director of Healthier Here. And So I'm going to start off by just, for those of you that don't know who we are, I'm going to tell you a little about us and what we do. And then Victor and I are really going to talk about how Healthier Here is approaching our work around equity and anti-racism as sort of a backdrop for you guys to think about as you begin the conversation. So first and foremost, the hallmark of who Healthier Here is and how we work is about cross-sector partnerships. So not unlike the HILT, we have a variety of partners from our governance structure, how we set our governing board, to how we make change happen. We are successful because we work with and across the various sectors, and we bridge silos in our region. So our partners, these are just a few of our partners on this slide. They range from representing consumers and advocacy voices, tribes, social service agencies, pretty much the entirety of the healthcare continuum, from hospital health systems to behavioral health agencies, our community health centers, and so forth. Payers and insurance companies, and then government and philanthropy are also a part of who we are and what we do. Healthier Here is also contracted with the State Healthcare Authority to be the accountable community of health for the King County region. And so in that role, we are facilitating delivery system reform through the state's 1115 Medicaid waiver. And we know we've been involved with HILT for probably since the inception or early on. And we know that many of the organizations that we partner with are also partners with HILT. So we'll talk about how that plays in as we go down the line here. But this is our mission, the mission of Healthier Here, to eliminate health disparities and improve the health and well-being of all people in King County through our innovative cross-sector collaborations. We know that inequities in power, money, and resources lead to inequities in daily life, which then turn into inequities in people's health and well-being. And so our intent is to change this equation.
Susan, you're muted.
Susan, it looks like you just went on mute.
Yeah.
Ooh, sorry. I don't know how that happened. Can you hear me now? Did you hear anything about our mission? Okay, good. All right. That is weird. Okay, so I'm going to just sort of move into what makes us unique as an organization is how we center our values into our work. So first and foremost, Healthier Here leads with equity. So we are working intentionally across our bodies of work to eliminate disparities in health and well-being and address current power dynamics and structural racism in our healthcare system that perpetuate those inequities. We do that through our community voice and engagement. It's one of the ways we believe that populations that are most impacted by health inequities play a substantive role in changing the system, and they play a huge role in Healthier Here and the work that we do, and they are valued for the expertise that they bring to the table. So we try to make sure that community members and voices have what they need to engage effectively with us. We develop formal ongoing feedback processes for the decision making so that we are responding directly to our consumers and taking action on consumer recommendations. We believe in collective action and equitable partnership. I heard this actually come through in some of the conversation earlier about that we're better together kind of concept. Intentional partnerships with and parity between all of the organizations that are involved with us. And then I mentioned that we're working on innovation and transformational change. We know that the system does not work well for everybody, and that we are, the United States as a whole is getting some of the worst outcomes. The disparities, while King County in general has a lot of health and well-being, the disparities for some of our communities, in particular our communities of color, are significant. And then we use data to drive and inform the work that we're doing and evaluate outcomes through as we're making the transformation, both to make sure we're improving health and well-being, but also to make sure we are advancing our mission around eliminating health disparities and not inadvertently making them worse. So that's a little bit about who Healthier Here is. And now Victor and I are going to talk a little bit about how we're approaching equity and anti-racism. So we have kind of adopted a framework of understanding that work around equity and anti-racism has to happen at multiple levels. So every one of us as an individual person in our region and in this space have things that we need to work on and are on our own individual journey around awareness and understanding of equity and how racism shows up and our own privileges that we bring to the table. And so the individual work is an important part of that. There's also at the institutional level. So this is the organizational policies, practices, and procedures that might be impacting equity and health disparities for individual organizations and the work that we do as an organization to improve upon that. And then there's the system and structural racism that exists in our world. And this is how the entire system works together to impact equity and perpetuate health disparities. So you will see as we go forward that we are looking at and planning around all of these areas as an organization and with our role in system change. So I'm going to pass it to Victor, and he's going to talk a little bit about what the Healthier Here Governing Board is doing and how they've approached it. So Victor.
Great. Thank you, Susan. So as Susan had referenced, the Healthy Here Governing Board really has a framework that focuses on equity and anti-racism work. And as a board member, what I really appreciate about the Healthier Here Governing Board meetings is that we always start a board meeting with an equity moment where each one of us gets to reflect about an equity moment that we're reflecting on, whether it's on a personal level or professional level. Beyond the Black Lives Matter movement and the recent anti-Asian racism against Asian Americans and Pacific Islanders, prior to all that, Healthier Here is really leading with equity, which I really appreciate. As a board, we continue to really learn together and define what actionable steps we should take together. So essentially, we can hold each other accountable. And one thing that I will also note is that because of the work that we do together that's front and centered on equity and social justice, it's also resulted in Healthier Here 2021 action plan that our board is committed to. Susan, can you move to the next slide, please? Great. So when we talk about learning together and how to hold ourselves accountable, then essentially we come up with some activities that we do together. And this is something that collectively we agree on. So some activities that we select books, articles, movies, documentary lectures to view and read together and discuss it. And as a board member, I really appreciate that we are so intentional around this, because to understand equity, racism, it's not going to be a one-time only training, and which is why I think that with a timeline and frequency that we can get together, that you can see here for the reading is highly helpful for me and the board. And some recommendations that you can see in this table here that we actually recently viewed a reading for a documentary kind of talk show format by Dr. Candy at the Seattle Arts and Lecture Festival. And we got to then have, as a board, be able to discuss that with community members as well. And some recommended readings that we are in process of doing it right now is How to Be an Anti-Racist. And we are also going to be watching documentary Power to Heal together. So as you can see that we are really making this really intentional and providing different platform, because different people have different preference and access. And we also invite local speakers to present to the board and facilitate discussion on the impact on racism. It's going to happen in July and then in October. Some recommendation is that we know that the BIPOC community significantly has always have access and disparity issues. So we are going to have a panel that focuses on native and traditional healing. And when it comes to healthcare access, oftentimes I love working with older adults and adults population, but youth oftentimes is left out of the table on the discussion. So I really appreciate that we are also going to be having a panel that focuses on youth who historically have been left out on the table for discussion in the healthcare system. Can I have the next slide, please? As you can see, Susan is in control here. So the actionable steps that we have been taking as a board is very recently, I think last month, we finalized the individual equity plan that each one of us will complete as a board member. We'll identify 1 or 2 goals to work on for 2021. this individual equity plan can be a personal plan that I may be reflecting on how do I want to make sure that in my personal life I'm addressing equity, or this can be a professional equity plan that I integrate into my current work plan. And we agree that we will do monthly check-in with small group. And I neglect to mention that in while we watched Dr. Candice firm through the CLS lecture, we actually, during the board meeting, we carve up time, break into small groups and have those small group discussion, which I really appreciate, because in a small group setting, I think it allows us to be authentic and also share vulnerability in that space. And for this individual equity plan, we plan to have a quarterly check-in at the board meetings. And I referenced about a small group to match on goals. So Susan referenced at the beginning that our board is a multi-sector board. And beyond that, it also has different organization of different size. So we're also trying to intentional to figure out when we have those discussions, who we can match together to provide support for one another, and essentially making sure that we're on track to address equity. Can I please have the next slide? I think the next slide is yours.
Sorry, you want me to do this one, Victor? I'm happy to. It's still part of the board plan, but I'm happy to do this one.
Oh, you know, sorry, that's mine. See,
okay.
It's a Thursday thing. It's a Thursday. So accountability, we talk about those action steps, and then we then have to really review and refine our equity dashboard measures. Some people who know me know that I'm a very nerdy person. I think that without having performance matrix and KPI to make key performance indicator, it's really hard to articulate how we are doing as a system. But Healthier here has been providing really great PME and KPI dashboards. And I love that how we are looking at the data to ensure that if there's disparity issues with populations that are, again, having access issue to healthcare, behavioral health, or social determinants of health, being very intentional about how we can support them with an equity lens to do that. To me, I find that really, really refreshing, because oftentimes when we talk about PME and KPI, equity is also not often mentioned. So we continue to refine and figure out how to learn together and improve those matrix. Because to me, the PME of KPI, every data, every number that we see tells a story of an individual, of a client. And that is how that PME comes about. And it's really important that we address equity through that. And we are also, as a board, beginning to review our equity definitions and the guidelines we have to, as a board member, what does equity mean to Healthier here? And how do we actually put that into actions? And that's something that we are going to be doing between June to December. And at Healthy here, we had a community, I can't remember what the CCV community.
It's Community and Consumer Voice Committee.
Community and Consumer Voice, and then the Ingenious Nations Committee, to really be intentional that in this planning process, we include client's voice in that process to really guide us and think through together to be very inclusive about doing this. And I'm pretty sure this is your slide, Susan or Sarah.
Thank you, Victor. And my apologies for putting acronyms in the slide deck when you pull stuff from the board who's familiar with it. Sometimes you forget to change, but thank you for that, Victor. And so that's how our board, the governing board of our organization, is approaching this work. So you can see and you know that in order for us to be successful in evolving to an anti-racist organization, all levels of the organization, including the leadership at the board level, needs to be involved and needs to be working actively on it. So I wanted to also highlight a little bit about what we're doing at the organizational level, internal to our organization with our staff. We are also using the framework of the individual level, the organizational level, and the system level. At the individual level, it's really about what is the role of Healthier here as an organization, and how can we support our staff in their personal or individual journeys towards equity and anti-racism. So this looks anything like setting aside professional development funds so that people can participate in and attend equity trainings and development, bringing trainings into the organization around equity and anti-racism. We have an internal reading group that started recently where we are also reading different things together and then discussing them on a monthly basis. And then starting up affinity groups is another example. We have been exploring this for our staff, whether or not this would work for our organization. So those are some examples of things at the organizational level. At the individual level of how we can support our staff in their journey. For the organization itself, this is about ensuring our policies and practices are equitable. So we have been embarking on a process to examine our hiring practices and look at what do our job descriptions look like, everything from where are they getting posted and are we reaching broad communities, to being transparent in terms of salary ranges, reevaluating whether or not degrees are really required to do the function or support the function, and then how we do interviews and screen candidates and so forth, to what our organizational culture looks like, how people are welcomed into our organization and feel comfortable and can bring their authentic self. Also, how we're addressing holidays. We've made a big shift in that. We've added, for example, Juneteenth is a holiday, a formal paid holiday for our staff. We've also added floating holidays so that if the traditional, Christmas is not what your culture celebrates, but you celebrate a different kind of holiday on a different day, you can move your holidays around to match your cultural or religious needs. So those are some examples of organizational level strategies. And then at the system level, it's really about, we're in this unique role at Healthier Here where we have Medicaid waiver resources to invest in the system to get it to work better. And so it's asking the question of how do we use our leverage, our sphere of influence, and the resources we have available to advance anti-racism at the delivery system level. So Victor talked about our equity dashboard. With those are measures that we're looking at. How are we doing as a system? And then we also, Healthier Here is looking at how we do contracting, where we allocate our resources to make sure they're going to the people and places that need them most. King County historically has a way of spreading, doing the peanut butter spread, I call it, where everybody has to get their fair share. And that is not equitable. We know that there are people and places and regions in our county that need it the most. So here's some examples of how we have used our leverage and influence and resources to advance equity and hold providers accountable. So first of all, Healthier Here right now has contracts with 27 clinical partners. These include some of the larger hospital health systems, the community health centers, many behavioral health organizations, and tribal health entities in our region. In those contracts, we call them pay for progress contracts. So they are incentive-based, performance-based contracts where we reward providers for meeting certain milestones around transformation. In our 2019 Pay for Progress contracts, we included 3 deliverables of our partner organizations. Each one of them needed to complete an equity assessment tool. So assess their organization, where they're at in their anti-racism and equity, participate in equity and racial justice training that Healthier Here sponsored, and then develop an organizational equity action plan, not unlike what you just heard that Healthier Here is doing and what our board is doing. And so each of those deliverables and milestones earned providers incentives to advance that work. 2020 was supposed to then really get providers going on their equity action plan and tying the incentive dollars to the goals that each and milestones that each organization set for themselves. Unfortunately, we were hit by a pandemic in 2020. And so in recognition of the burden that was on providers just to be responsive to the crisis, we put all of that, the reporting around the equity action plans on hold. And so we are just in the process of getting those started up. Towards the end of 2020, we also then mimicked those requirements for the 2021 contracts for our community-based organization partners. They were a little bit further behind on a different trajectory in terms of engagement with Healthier Here. And then of course, also we're responding to the pandemic. So that's why that requirement didn't start till 2021, but we actually just completed the training with all of our CBO partners, and they are working on their equity action plans as we speak. So that is happening. And then one other thing I wanted to highlight, and my internet is unstable, so I'm gonna shut down my camera so you don't lose me. But the other thing that we did with regard to our resource allocation was we first utilized the way we allocated resources and incentives to providers. We included what we kind of termed an equity bump in how we pay for progress contracting, so that those entities that historically were under-resourced would earn more incentives than larger organizations. So this is a really different way of thinking, but so for example, in our pay for progress, hospitals earned the least amount of incentive, community health centers earned a middle amount, and then the behavioral health agencies earned the largest amount in the clinical healthcare system, because the behavioral health system has been so historically under-resourced, and they had further to go to get to equity in the like basic infrastructure and capacities that were needed to transform the system. We have also created internally an equity tool that we use to evaluate all of the proposals for funding. And with this tool, what it does is it synthesizes information about all of the different entities that are applying for resources. And then we look at it through an equity lens to make sure we first are funding organizations that are serving a majority of people that are experiencing health disparities. We look at it to make sure that the resources we are funding organizations that are in the places in King County where by the heat map data that we have from public health have the greatest health disparities as well. So we really apply that equity lens. We are not trying to give everybody the same amount of money. We are really trying to get resources to the people in the places that need it the most. So I'm going to turn it back to Victor. He's just going to talk about a little bit about, since he represents an organization as well as the board, how ACRS actually engaged with us around this equity action plan and assessment and their work.
Great. So prior to working with the other counseling service, I worked for Asian Counseling Referral Service, ACRS, which is a multi-social service organization that focuses on Asian Americans, Pacific Islanders, immigrant strategies, and other vulnerable community. And our focus is really around, I would say, integrated managed care, which is primary care and behavioral health care. But we are an organization that also provides social determinants of health services. And we're very, very fortunate to be a partner and grantee from Healthier Here for the clinical innovative partnership as well as the community innovative partnerships. Susan referenced earlier that for the providers, we are also asked to be doing the equity plan and also have to be intentional and the ability to earn incentives. But then what I want to share, what ACRS has done is that as a leadership team and management team, we began to do even more self-reflection. We are a social justice-driven organization. But I think what the pandemic has done is, along with the BLM movement and the anti-Asian racism that I referenced earlier, I call it a perfect storm that almost magnified the institutional barriers and the racism that the vulnerable community had continued to face. And so the leadership team management team at ACRS really take it to heart and figure out what we can do during this very challenging time to really be intentional about creating equal access for the clients that we serve and our staff as well. So we meet on a month, at least monthly, and we continue to refine and enhance our work plans to meet the PLE along with equity perspective, and also take a pause before we are thinking about expanding certain programs, beginning to self-reflect on, is this the right program for ACRS to expand? Does it align with our vision and values and mission? Or is this something that will actually help us to support more individuals who are more vulnerable? On a line staff level, this is what I really, really love and appreciate about the line staff at ACRS. In lines as the Black Lives Matter movement, ACRS staff, line staff actually forms a group called A4BL, Asian for Black Life. And this group is actually all formed by diverse staffing throughout ACRS. And they then take the lead on guiding us on our equity plan, providing feedback to the leadership team on what we need to do to support BLM movement in our implementation plan. And beyond that, I believe we started the DEI, Diversity, Equity, Inclusion group, also driven by line staff. And I think that started about 2 years ago, and they really provide feedbacks in around what kind of funding we should go after and what grants we should pursue, or what I referenced about what we should take a pause on. And again, I love the fact that these two groups are initiated by line staff to demonstrate that leadership can truly be inclusive and happen on all levels. And we also have a program called QVAP, Queer Vision Access Program, that focus on addressing disparity issues for the LGBTQIA community. And these the two groups and the QVAP program really guide us in our decision making and strategic planning. And we meet at least monthly as well. And this process, as I shared, is driven by line staff. So we share authority with an even more inclusive approach at ACRS to do the work to guide us truly to be an organization to continue to lead with equity and address social justice.
Thank you, Victor. So I love this quote, and we are in a time of challenge and controversy. That all of the events of the previous year and the continued recovery from the pandemic and racism being declared as a public health crisis. Like, the time is now, and it's going to take all of us working very intentionally and collectively to dismantle racism in our institutions and structures and get to equitable outcomes. And Ryan, were you going to say something about the overlap, or do you want me to do that?
Yeah, actually, that's a great transition point, and thank you, Susan and Victor, for joining us today. If we get some virtual round of applause for both of them sharing just the amazing work that they've been doing and being willing to come here today to share the wisdom for that. And as Susan teed up, HILT and Healthier Here are very intentionally working more collaboratively. At our last meeting, we are actually taking a dive into, we have a lot of the organizations that are on this call are part of Healthier Here, and we've started looking into where are those connections so that we can have those of you that are members of HILT be able to potentially connect with members in your organization that might be in a different department or maybe in a different building that are serving with Healthier Here. And then, we do have not only this shared commitment to anti-racism, and so being able to learn from each other right now. HILT is really learning from those great steps that Healthier Here has taken, but also, as we talked about in the behavioral health space, there are some opportunities for collaboration as well. So we're just super honored to have Healthier Here attend this meeting, but this is just step one of many as the organizations continue to work together towards the shared vision to be able to have a more equitable health delivery system. Susan, anything that I missed there? And again, I apologize for the wrong name on the slide.
No problem. No, I think you covered it. I think we will get information out for those of you that are partners with Healthier Here and who to contact, because it's because of the different people in the organization. And then I think we just really look forward to working with you guys. We have a lot of conversations at our tables about workforce issues and everything from the pipeline to recruiting, retaining, and having a more diverse and more reflective workforce in the delivery system. We know that's a big part of doing this work and getting to anti-racism. So just look forward to connecting more with this group and aligning our work. And I think the more we have shared goals and outcomes and actions around this work, the more effective we'll be doing it together.
Great. Thank you so much. And thanks again for Victor for joining us as well. And Seattle Counseling Service is just an awesome organization in our community. And once we get fundraisers back, I will put this, and I promise Victor did not prompt me for this, but their fundraiser is a must-have ticket. They're an amazing organization. So hopefully once we get back to having in-person events, we can collaborate that way. So we are going to move into breakout groups. And James, if you could throw the slide up that has the questions for our group, please. And we're so much great information today. We are just running a little bit behind, but I think it's really important that as we've had this amazing wisdom shared with us, for us to take a moment and really want to focus on these last two questions, which are, we're trying to find those action components. So what are those things that we can start to act upon as HILT together with Healthier Here and collaboratively as a network towards becoming an anti-racist industry, and then what we can do individually, collectively, proactively, again, focusing on that action step. So myself, James, and Lisa will be lightly facilitating the groups, but we really want to hear from you all. So with that, James, go ahead and push the red button and send us into our breakout groups.
We're back in our breakout room. You're mute. You're mute, James.
Oh, thank you. Yeah, me too. I was like, it looks like the same people. But I think all the breakout rooms will close in 24 seconds. So anyone in our group want to speak out about what we talked about? That's right, I'm asking you, whoever's feeling uncomfortable in this question. Thank you, everybody.
All right, welcome back, everybody. As we have 7 minutes left, we're just going to really quickly share out. Lisa, I'm going to pass the baton to you, and if you just want to give a 1-minute share out of some of the highlights that your group talked about.
Absolutely. So we started off with a conversation around getting more exposure about what is actually happening to the right communities, making sure that this messaging that we're talking about and this exposure, that we're using common lexicon and language across the industry between HealthPoint and Kaiser Permanente and Sound Mental Health, right? The Area Health Education Center of Western Washington brought up the fact that accountability and measurement is imperative, but also how that in using data in that, and then how sharing it transparently is even more important, and that's how you can get accountability. And then towards the end, we talked a lot about crosswalking HILT network memberships with our Healthier Here networks to see if who's who in the zoo. Oh, that was 1 minute. Real quick, who's who in the zoo at your organization, so that DJ3 can connect with his leadership that's already doing the work at HealthPoint, but then having those conversations from a healthier, or from a HealthPoint standpoint around really moving that commitment forward. And lastly, is there a space, a digital space that people can visit, a community of practice, a Facebook group, where the common lexicon can be shared, where issues can be arisen around microaggressions or debates around definitions, because people just pop into their social media or their Facebook groups, and what does that look like? What could the moderation of that look like, and what benefit could both networks receive from that type of communication strategy?
Great. Thanks, Lisa. James, I'll pass it over to you for 1 minute. And the things that we don't want to share out, we will share out in a written update. So just because it may not get said here, we will gather all those ideas and send it out to everybody. James?
Yeah, we got some really good discussion, and I would say it got pretty intense in some areas in the sense of the areas. Generally we know that our next step is to look with Healthier Here and look at our anti-racism work, using them as a model and embedding the best ideas that work for HILT. Not every model works for every single organization just perfectly. So definitely looking at that from a critical lens. And then basically, if we want to partner and we want to connect with others, then we have to set up a plan and have buy-in and dive in deep with that. The conversation changed a little bit because we were talking about there is no A in anti-racism, and meaning you don't get an A+ grade, meaning that is the hard work. The anti-racism is the hard work, and it's not an area where everybody celebrates at once, but it's really a time where we do the hard work and move forward. One of the things that we were talking about as well was just the transparency of looking at historically the way we've kind of transitioned with BIPOC communities and with non-people of color, that how that works in the workforce, and understanding that sometimes we have to move to the side to let other groups kind of come up, and really leveling the playing field and making sure that all groups have those opportunities to increase and rise up into their professions. It was a good discussion, and more to come on that.
Great. All right, thanks, James. So I'll just share out two kind of concrete examples from our group. Diane Sesney shared out that they have created a rapid response team at Kaiser for workers that might be exposed to a racist incident. That could be from a coworker, it could be from a manager, it could be from a patient, because of the particularly the tense environments that we're facing. And so I thought that that was a really innovative practical intervention that might be something that HILT could share out, that potentially could be a tool for other organizations to use. The other thing that came out was really focusing on that middle manager or that hiring manager, to ensure that that a lot of times hiring at that level is an urgent thing. Oh my goodness, I have a spot, I have to fill it, as opposed to that intentionality and empowering that frontline hiring manager to be able to really take their time with an equity lens, both in terms of the recruitment, the selection, and then the retention. And really trying to make sure that we're addressing some of the broken rungs that as people are advancing their careers and being able to stay. So with that, again, we will gather up all of the comments. I have about 2 pages of notes in writing, and we will share those out at the end. But for our closing comments, I'd like to pass it over to Angie Graves. And Angie, any parting words for us on concluding the 3rd birthday for HILT?
Well, thank you, Ryan. I'm happy to close us out. I think this was another awesome day and meeting and of collaboration and understanding the direction that we are all going in a collective way. Happy birthday to HILT. I think it's amazing. I know from my perspective, and I'm sure many others, that we've been in this for 3 years. And it's exciting also to see the action forward that we're taking, and that mindset of we need to get some of these actions in place to really show that we're walking the walk in what we are promoting and what we are here for. So very exciting. Happy birthday, everyone. Thanks so much for being here. Please pass on to your friends or other colleagues to join the group and join these meetings on a quarterly basis, because everyone's input is incredibly valuable. Thank you.
Thanks, everyone. We will see you at event coming to you soon. Or Dan, I'll see you on Friday on the tennis court.
Oh, what time are you coming in?
I'm on the 140. Hold on, I think it lands at 140. Hold on. Yeah, 144.
Okay, I will be there to pick you up.
I'm playing on Dan's tennis team for a USTA event this weekend. So, yeah.
Nice. Nice.
Yeah.
All right.
Good deal. All right, I'll see you tomorrow.
Good job, you guys.
Email or something.
Yeah, I didn't know. I thought it might be time, but I didn't know.
Yeah. Let's catch up on email, especially since I'm about to go out.
Yeah.
Thank you. Well, I don't know if did you send out Hey to this network, the Hey thing to this network? I think you did.
Yes, it was in the ways to plug in email that went in at the beginning of, or went out at the beginning of April.
Yeah, thank you. And Kaiser already responded, by the way.
Oh, nice.
Yeah.
All right.
And sent me a nurse, a male nurse, something, I don't know. It's great. So, yeah. Bye, everybody. Thanks a lot.
Bye. Thanks, Jennifer.
Yeah. Bye.
So Lisa, I actually thought you had to jump out to the WDC meeting. I thought whenever the business services contract was coming up, I thought that's what you were jumping out for.
No, my husband knocked on the door. He's like, the general contractor is here. You gotta talk about this. And I was like, that was literally the worst time all day. No, I'm gonna jump off right now and
Okay.
see what's happening. But
well,
great job.
What about how? Yeah, we had to juggle things with people like not showing up and things. Like, all right.
No worries. Well,
okay. Midday drink for all of us, or at least, or sorry, Lisa. We'll just keep at.
How about you
bubbly
guys?
soda?
Have one for me. How about that?
Have two.
Yeah, 2 midday drinks for each of you.
Okay.
That and I got to carb up because I got to play 4 matches with Dan this weekend. So like I'm gonna be exhausted. So
Are you gonna be in Yakima?
well, actually Spokane. So
Okay.
it's a USTA League tournament, and he needed a player, and I was like, oh well, sure, I'll go play tennis with you over in Spokane. So
That sounds awesome.
I'm gonna build the time to HILT, right? So
Yep. Recording this, Ryan. Wow.
Only if you win.
Crap,
Only
we
if you
gotta
win.
edit this out. All right, talk to y'all later.
Bye.
Bye.